Good Saturday morning to everybody, and welcome to HyperFit Radio with Dr. Charles Guglin and Francesca Guglin. I'm Gary Byron. How are you guys this morning?
We're good.
Very nice.
Spring seems to have happened.
Oh, man.
Overnight.
Well, you know, here, we get some good temperatures, and then it gets cold again. And then we get some great temperatures, and then it gets,
Yeah, it's Connecticut.
I know.
Yeah.
I know.
I'm ready.
And then, I was having this conversation with somebody just the other day, where, Gary, don't get too comfortable with the 60-degree temperatures because Mother Nature in the month of March here in Connecticut, not just snow, we could actually get a snowstorm. But then I quickly reminded the person that I'm like, should we have a snowstorm? It'll last a few days, and 3-4 days later, it's gone.
Right.
So
We melted.
Right.
the way the sun is positioned.
Yeah. March always throws a curveball. Yeah, always throws.
Isn't
a
that
curveball.
true?
Yeah.
I tell you. How's business? How's your last week? I haven't seen you in a week.
Good. Yeah, we're booking 2 weeks in advance now.
Whoa! Well, that's a good sign for many reasons, right?
Yeah,
Because there was a time where nobody would come in and visit anybody in the office anymore,
That's
right?
true. That's so true. I mean, the office was like a ghost town
People are feeling
for a few
more
months there.
comfortable,
Good.
Yeah.
Yeah. All right.
People are getting vaccinated.
You know, one of the great things about this show, and this is really the compliment that I want to share with both of you when I talk with people out and about and making appearances and so on and so forth, is that you talk about things that you're not supposed to talk about. You talk about things that people get uncomfortable with talking about.
Yeah.
But yet it's handled with class and with dignity and with maturity. It's we're not cracking jokes or anything like that. Although we're kind of goofy people, but that's besides the point. But these are topics and issues that need to be addressed and need to be discussed openly because we're all humans. We all have the same body, more or less. And listen, it could save your life by not having, by suppressing this and not having these discussions, and you said this a number of times, having this discussion with a doctor who has got a tight schedule and has got to get to the next patient and really can only give you about a minute or two, and then that's not really doing your diligence here.
No, it's not. I mean, their doctors' hearts are all in the right place, and they're smart people, and so on and so forth. But you kind of have to have a concentration of effort around these things, and it takes time to discuss them.
Yeah.
And quite frankly, in insurance practice, those poor docs just don't have the time to discuss this stuff with their patients. And a lot of times patients don't bring those subjects to their doctors. Part of why patients bring those subjects to us is because we advertise that we're there to talk about it. I really think that that's part of it. How many times, women go to a gynecologist and they don't talk about vaginal issues. Men go to their own personal physician and they don't talk about the fact that they have erectile dysfunction, those kinds of things.
And not only that, they don't come home and share it with their partner.
Sure.
When your wife or your significant other goes through menopause, or when if you're a male and you go through andropause, you're not sharing that necessarily when you come home with your partner.
Yeah.
And when we can discuss this openly right here on the airwaves that everybody can listen to, it's really key. This is probably one of the most important shows you'll hear on the radio. And we've covered erectile dysfunction, as you just mentioned. We've talked about menopause. We've talked about weight. It's so many, really so many different things there, and that's the true benefits of this show. And by the way, folks, we'll repeat some of the topics, but there's still so many more to get through, including regenerative therapy, which is what we're going to be talking about today. What exactly is regenerative therapy?
In 50 words or less.
Hey.
Yeah, right. I'm going to try. I'm going to do my best.
Oh, we got the whole show.
Yeah, right. Regenerative therapy is using your own immune system, stimulating your own immune system to recognize the fact that there's some part of your body that needs to be healed, especially in situations where you have chronic inflammation, let's say osteoarthritis of the knee, okay, something like that. Or you have a chronic partial rotator cuff tear, something that a doctor or an orthopedic surgeon or somebody has sent you to physical therapy, and that's about all they can do, or they're offering you surgery in a situation where you don't want to have surgery, that kind of thing. Regenerative therapy is a way of mustering your own immune system to recognize, number one, that the injury is still there, and number two, to start to do something about it.
Is it true the younger you are, the quicker you naturally heal? And the older that you are, the longer it takes to heal naturally?
I think empirically we would all say that, definitely, yeah.
And actually, I want to just delve a little bit into healing naturally, as opposed to, and I guess an expedited version of healing. When you heal naturally, you're just letting Mother Nature in time take its toll on your body, as opposed to maybe seeing somebody like yourself, right?
Well, yeah, but a lot of times, for instance, things with like osteoarthritis or partial tendon injuries and things like that, your immune system you heal as much as you can heal, and then you reach this point of just chronic inflammation. In other words, your body, things have crossed over to the point where the chronic inflammation is really just is all that you've got left, and your immune system has moved on to other things, okay, or gone back to rest, whatever. And regenerative therapies are really ways of just saying, alerting your immune system, hey, there's something going on down here that you guys are not paying any attention to, and it's time for you to start paying attention to it again. The sweet spot for these kinds of therapies, for instance, let's talk about a knee. You've got osteoarthritis of the knee. It's bothering you. It's affected your quality of life. So you've gone to see an orthopedic doctor who legitimately says, look, hang out, work with that knee as long as you can, because when we replace that knee, you've got a 15, 20, or however many years of use of that replacement before you're going to need to have more surgery to fix it again. So hang in there if you can until your 50s and 60s, and then we'll replace that knee, and you'll be back in shape again. The sweet spot for regenerative therapy is that time between that evaluation and the time that you're ready. It's affecting your quality of life to the point where you say, okay, screw this. I definitely need to go and have this operated on. It can prolong that time indefinitely to a certain degree by availing yourself of these therapies.
Yeah, because the longer you wait, okay, to put off your surgery and you have a replacement, your replacement could actually take you to the end of your life, right?
Sure. Yeah, absolutely. Yeah.
Let's talk about stem cells.
Okay. There's a lot of noise out there about stem cells. For instance, a lot of people sell stem cells to patients, telling them that, well, when we put these stem cells into your body, or when we put them into your elbow, or we put them into your back, that they're going to change miraculously into cartilage, or it's going to change miraculously into new nerves that are going to fix your problem. First of all, let's define what stem cells are. Stem cells are what are called pluripotent cells. We all have stem cells. They line our blood vessels. They are there to help us in situations when you cut yourself or you've injured yourself. Stem cells find their way into that milieu and do become different kinds of cells depending on what they need to be. They can be fibroblasts that lay down collagen. They can be endothelial cells that help to create new blood vessels, so on and so forth. The myth of stem cells, especially when it comes to orthopedic injury and things like that, is that they can create new cartilage, or that they're going to repopulate an area with new tendons or whatever. That's really not what it is. And we'll talk about platelets in a sec, because regenerative therapy is basically utilizing these cells to alert your immune system to get it going, to healing this problem that it is you're using them for. Okay.
Your body makes its own?
You should explain PRP.
Come on, just come up a little bit closer.
Platelet-rich plasma is platelets. We all know that platelets initiate the clotting cascade, right? You cut yourself, okay? Let's say you cut your arm. The first thing that happens is you bleed. That blood brings platelets to the site. Platelets do what's called degranulating, and they initiate the clotting cascade. But what platelets also do is liberate into your bloodstream what are called cytokines, which are chemical messengers that call to this area all of these cells that we're already talking about: stem cells, white cells, neutrophils that trap bacteria and carry them off to the liver for detoxification. Monocytes, which are basically white cells that are garbage trucks. They come through and they clean up devitalized tissue and that sort of thing. Lymphocytes, which, as we all know, because we're buried in information about lymphocytes now because of COVID, they create antibodies in situations like this. So platelets are critical to starting the healing cascade also. Stage 1 of healing is inflammation. All those white cells come to clean up the wound. Phase 2 of the healing cascade is fibroblasts come into that area and lay down new collagen. And what does collagen do? We all know what collagen does. Women buy millions of dollars, women and men buy billions of dollars worth of collagen, and they plaster it on their face every year, which really does nothing. The only way you can get new collagen into your face or into your tissues is through injury, okay? Collagen is the structural component of a wound, or of a healing wound. And then phase 3 is always what's called neovascularization, or new blood supply. And that is really key to healing wounds when you're talking about something like osteoarthritis or tendon repair or tendon injuries, things like that. That neovascularization, that new blood supply, is part of the regenerative, we call it regenerative therapy for a reason, the regenerative process of bringing tissue to that area so that it will heal.
So your body will heal itself to a certain point, depending on your age, and then these 3 phases kick in.
Your body will heal to a certain point, and then it gets tired of trying to heal
Right,
it, okay?
right, yeah.
And what we're doing is we're basically supercharging the system.
Gotcha.
Yeah.
All right. You had mentioned platelets, and I know that platelets are, well, they're for clotting, but how are they helpful here then?
Well, they're helpful. They're helpful in regards to the fact that they are. Well, let's say you've injured your Achilles tendon. Okay, you've been to physical therapy, and they've done all they can do for you. You've been to an orthopod who says, well, it's not a full thickness tear. There's really not too much that I can do for you from a surgical standpoint. But this becomes a chronic problem for you. You try to run on it and it hurts. You try to walk on it and it hurts. It forms a callus around the spot where it has been trying to heal, which is a callus is just a lumpy scar. If you take platelet-rich plasma and you inject it into that area, again, like we said, you're restarting the healing cascade, so this area starts to remodel. You start to get new tissue coming in, collagen coming in, new blood supply to this scar, this scarified part of your Achilles tendon, and not suddenly, over 6, 8 weeks, 10 weeks, this lumpy callus smooths out. Your Achilles starts to work for you again, becomes less painful, and then you can walk on it again. It's not a miracle. It's simply mustering your body's own ability to heal in a situation where it's basically has, like I said, moved on to other things. Okay?
Your body works in a wild
Human
way.
body's an amazing thing. Human body is just an amazing thing. And sometimes it just needs to be coaxed. That's all.
And that's and how that applies to age management.
Well, it's a good question. I have no idea, but I would say probably that it applies to age management because as we get older, we have all of these niggling sort of osteo or arthritic problems that are not really. They're not really surgically oriented. They're not something that surgery that you're willing to go through surgery for. I mean, we all have a little bit of back pain. We've all. One of the things I talk to my patients a lot, I got guys that are 45 or 50 years old. They're still going out on Friday nights and playing basketball. And I tell them, basketball is a young man's sport. You should not be playing basketball because what do? They all rip their ACL. They all ruin their knees. They cut one way and they turn their ankle, stuff like that. So these become chronic injuries that just plague you, and it's very much a quality of life as you go into old age. So
yeah, but people, I mean, you and I'm talking to the person who probably hears this I shouldn't say probably does hear this on a daily basis, but giving something up that they've been accustomed to their entire life because they get to 45 years of age, that's almost admitting to yourself that, I'm getting older. I can't do the things that my body used to be able to do.
You can reverse it.
That's a hard pill to swallow, though. Well, you can't. I mean, you can reverse it to a certain extent.
To a good extent.
Yeah?
Well, well, first of all, I never tell somebody who's healthy and not injured or whatever to stop playing basketball. It's usually when they come to me with they're hurting. And I say, okay, now's the time for you to quit, right?
But we're trying to be preventative here, though,
Yeah, right. You're preventing further injury.
Yeah, but oftentimes your mind makes a promise that your body can't fill.
It writes a check that your body can't cash.
It's very true. Yeah. And it's because I think mentally we're one age. We're the way that we've always.
Oh my God, yeah.
Right? We always think of ourselves as I haven't changed, and then your body will tell you something otherwise.
Yeah, your body's always telling you that.
and this is the reason why HyperFit MD exists, right? For age management.
Yep.
I mean, listen, we're all aging. You can't do anything about that. You're going to get older, folks. Remember, there's two things guaranteed in life: death and taxes.
Yeah.
True.
Can't help you there.
That's right.
Okay? It's going to happen, both of them. But while you might as well enjoy the ride while we're on this side of the ground, right?
Yep.
You know, and live life to the fullest. And you can't let little things, and I say little things, it's all relative, I suppose, get the better of you or hinder your life. Especially when there are steps that you can take preventatively, as
Absolutely.
we talk here.
Very much a quality of life practice.
Tell me what a regenerative procedure is even like. Like, what can a person expect?
Well, it depends on it really depends on what you come to us for. Many practices, we don't do it yet. We're actually building the infrastructure so that we can do it. Will use what are called autologous stem cells. In other words, they will do a bone marrow aspirate and spin that tissue down and retrieve your own stem cells, and then re-inject those stem cells into whatever the issue is, whether it's a tendon, a knee, a hip, those kinds of things. So stem cell therapy is really taking your stem cells and isolating them and injecting them into the area of concern. The FDA, many patients, people with money actually, will go someplace. There's several places in Houston where they will take your stem cells and they will send them to Costa Rica. There's Panama. There's several clinics that do this also, where they will culture your stem cells, because these are live stem cells, and they culture them, and you send down 1 million stem cells, and then 6 weeks later you've got cultured billions of stem cells, and then you fly down there and they will inject those stem cells. Many people will just go down for what are wellness injections. They'll have their stem cells basically re-injected into their body. And the theory is, anyway, that those stem cells find their way to the areas of concern and will initiate a healing process. That is very pricey. It's like $30,000-$35,000 for something like that. The FDA puts a handcuff on people like us because they won't allow practices like this to culture stem cells. They're not allowed to be manipulated. You can't, and that is considered manipulating them.
Why? Because that'd be cloning?
Well, no, culturing them, cloning and culturing are two different things. Basically, they're taking these stem cells and allowing them in culture to divide enough to create more and more of them. So, not necessarily cloning, basically just growing new stem cells. The FDA does not allow that to happen. So basically what you're doing is you're taking stem cells from a person and you're giving them back those stem cells. Now, some of the issues that we talk about in practice like this is that if you take a 70-year-old stem cells and you give them back, they're basically senescent stem cells. They're older stem cells that basically are not as functional as they would be from, let's say, a baby or something like that. But autologous use of stem cells is something that is really becoming something that a lot of people are doing, and eventually I think we'll be offering that service. The problem is bone marrow aspirate is not a fun thing to go through as a patient. You can numb up bone, but when you aspirate that tissue, it's fairly painful. So, like I said, we're building that infrastructure. What we use now in our practice are fetal stem cells, and basically it's fetal stem cell product that you're using, because these are not live stem cells. They come from umbilical cords of donated placentas, and they basically contain in them all of these cytokines that we were talking about before, and it's very useful in this setting. Platelet-rich plasma is another thing. That's pretty easy. You just take 60 or 120 cc's of a person's blood, you spin it several times, and you wind up with about 6 times to 7 times the concentration of platelets. So an average platelet count, let's say if we took your blood, your platelet count would be 250,000. When we take your platelets and we spin it, we're winding up with, what's 6 times 250? So like 1.2 million, 1.3 million stem platelets. We're then injecting them into the area of concern, and you're recreating the healing process. And it's pretty remarkable how that works. And then we send them off. So the actual procedure is we take your blood, and then you're hanging around for half an hour, 45 minutes while we process that blood, and then the injection takes a couple of minutes. And then we send you to physical therapy for a few days we basically want to distribute that product around the joint so that it's touching every area of the joint. And then you take it easy for several weeks while it works.
Oh, wow.
It's a healing process. It's no different than having a cast on your leg. That takes a while.
I was right about to say, process is the word there. Yeah, I mean, it's not going to happen overnight.
No.
No.
It is not, and it's not a miracle.
Folks, you are listening to HyperFit Radio. Dr. Charles Guglin, Francesca Guglin, and Gary Byron here. I don't. What kind of problems can this kind of therapy be helpful for? It sounds like it's
orthopedic injuries, tendon injuries. We see people for chronic hip arthritis frequently. We do that a little bit differently because we access the hip joint under fluoroscopy because it's a pretty hard joint to find blindly using a needle. So. We do that under fluoroscopy. Like I said, tendon injuries. Many in Southern California and places like that, they do these wellness injections, which is we don't really offer that because I'm not sure that it works, quite frankly, when they take people's their own stem cells and they just re-inject them, do an intramuscular injection.
What is that in California? What are they hopeful to accomplish?
The theory is that they distribute themselves they basically distribute themselves to areas of concern. Chronic back pain, if you have lung issues, those kinds of things. There are practices that use autologous stem cells again for glaucoma, eye injuries, things like that. So it all depends on what you're looking for. For the most part, in our practice, we do it mostly for orthopedic stuff.
You had said something a minute ago that was really intriguing, and I wish you said you take something from a baby. What was that from the
a mom?
Jelly.
Yeah, it's called Wharton's jelly. Wharton's jelly is the connective tissue that surrounds the blood vessels in the umbilical cord, and it's almost pure stem cells. The lie is that these stem cells are alive when you're using them. They are processed the same way blood is processed. They're tested for HIV. The moms, by the way, contribute. These are healthy infants, and moms contribute this. They sign a consent form. They know when it's being gone on.
Good.
Yeah. It's donated by moms who understand where this is going, and it's all stuff that gets thrown away anyway. So.
And by having that from a baby, as opposed to your own,
right,
it's
universal.
You can inject them into anybody, but they are processed to the point where They are processed to the point where you're not actually giving live stem cells. You're actually giving everything that they provide, but you're not giving live stem cells.
Why was stem cell research why was that so controversial about 20 years ago?
Because of the cloning issue, okay? You mentioned the magic word, okay? Yeah. This whole, I think many people consider it a moral or a religious thing, that sort of thing. But we're not talking about cloning here. We're not talking about, we're not talking about abortion. It's all donated. Like I said, it's stuff that gets thrown away anyway. It comes with the confusion of the whole cloning thing with something like this, which literally has nothing to do with that, I think.
Then why couldn't they separate that? We're not using the stem cell for cloning. We're using it for this purpose,
Yeah.
People could abuse it, I suppose.
Well,
they can abuse anything, though.
Right. You can abuse anything. I honestly don't know, and I think that probably the handcuffs are going to come off fairly soon.
Yeah, sounds like it.
Yeah, because peer-reviewed science is clearly showing that this works. Patients are asking for it, and the pressure comes. Pressure comes from patients, just like politically pressure comes from constituents, okay? Patients want this, and eventually the FDA is going to take the handcuffs off, and practices like ours will be able to culture these cells and give people a lot more than what they're typically getting now.
We're running out of time. Can you just go into that really quickly? When you are afforded that, when you are allowed to do that, when the handcuffs come off, so to speak, it'll open up a whole new category.
Oh, my goodness, yes. Yeah.
What will you really quickly, what would you be able to do then that you're not able to do now? That will benefit your patient.
Yeah, just use several orders of magnitude greater quantity of very good product is the short answer. But these wellness injections, to do these wellness injections, you need boatloads of stem cells. You can't just give a few. And they need to be live stem cells. So they need to be autologous, and meaning that comes from you, using your stem cells.
Multiplying them in a lab.
Yeah, multiplying them in a lab so that you're giving a lot more of the same thing.
Which you're not allowed to do.
Right now.
Yeah. Oh, by the way, you can also get them from fat.
From fat?
Yeah, we mentioned bone marrow, but you can also get them from a person's fat.
Well, look at that. That shouldn't be a problem for many people.
Yeah.
Myself included.
Yeah.
Folks, I'm not looking at our producer. Right? That's okay. I'm not looking at anybody. I'm looking at the camera here. Yeah. Folks, don't get me going. He always, self-deprecating he is. Folks, let me give you a couple of phone numbers here, or a phone number here, and an email address, and even a website. Actually, check out the website first. That's where I always tell people to start. Not only can it answer your questions, perhaps, it might even spark other questions so that when you finally call Dr. Charles Guglin, he can answer them all at once. All right, so go to HyperFitMD.com. Once again, HyperFitMD.com. That's where I would start. Now, if you've got a question, perhaps you'd like to ask Dr. Charles Guglin, you can certainly email him at cguglinmd@hyperfitmd.com. And if you've got a question for this radio show, we want to hear from you. We cover nothing is off limits. If you don't mind asking it, the doc doesn't mind answering it. Easy to, in fact, you might be even helping other people who are listening to the show going, oh man, I wish I thought, what? I'm so glad you asked that question.
Don't forget the question email is hyperfitradio.com.
That's exactly where I'm going from here.
Sorry.
Hyperfit, no, Nate, your show, Doc. So I would want you to ask that question or email that question to hyperfitradio@gmail.com. Once again, hyperfitradio@gmail.com. And of course, the phone number, that's the easiest thing to remember. You can always call Dr. Charles Guglin at HyperFit MD. They're down in Milford, but you can call them at 860-890-9777. Once again, 203-890-9777. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening. Until next week, have a good one, everybody. So long.